Good morning, students. Today we will learn about the okay. So we already learn about the MCH RCH program. Okay, Janni Sisu Suraksha program, Janni Sisu Suraksha Karyakram. Okay. So further move on, we will learn about the reproductive health of maternal and newborn child and adolescent health program. Okay. So in short, it is known as the RMNCH plus adolescent health program. Okay. What are the goals of this program? That is to reduce the infant mortality rate, maternal mortality rate, and total fertility rate. Okay. So this is the main goal of the RMNCH program. Okay. So infant mortality reduced to 25 by 1000 live birth by 2017. Maternal mortality rate reduced to 100 by 10,000 live birth, and total fertility rate reduced to 2.1 by 2017. So by 2017, these three mortality rate is reduced. That is the target of the RMNCH program. Okay. So next, what are the intervention for the achievement of the goal? Okay. So that is the first we will learn about the reproductive health. So focus on the PPIUCD in high case load facilities means provided to the intrauterine contraceptive device to the all facilities. Okay. Then home delivery of the contraceptives, access to pregnancy testing kit, and strengthen abortion services means provide the provide to the mother as as an home, that is pregnancy testing kit, and strengthen for the abortion services. So guidance provided related to the abortion services. Then quality sterilization services also provide in this reproductive health care. Now what are provided into the maternal health care? So that the early registration of the pregnancy, and that can help into the full antenatal care throughout the 9 months of pregnancy. So if while the woman conceive a pregnancy, that time early registration of the pregnancy is into the institutional or proper PHC or CHC, so that the whole pregnancy phase and proper visit and care are fully done into that center. Then detect and manage the high risk pregnancy. If women have registered that pregnancy, then they can early detection and manage the high risk of the pregnancy also during the antenatal visit. Then highly trained person and equitable access to emergency obstetric care means in emergency care and for the ICU services, highly trained person necessary for the emergency obstetric care. Then review the maternal, infant and child death. So by survey and by whole report of the particular area yearly, the review of the maternal, fetal and infant rate of that recorded. Then give misoprostol to 8 months of the pregnant lady and opting for home deliveries. Okay. So misoprostol given to the mother by who has 8 months of the pregnant ladies. Okay. This is for the maternal health. Now learn about the newborn health. So for especially newborn health, early initiation and exclusive breastfeeding provided. So the for mother also, that is new experience. So assisted mother for the breastfeeding and proper guidance related to breastfeeding techniques and position correct. Okay, so that they can successfully feed to the baby, and baby also uh, can suck by the mother's breastfeeding. Okay, next one is a home based newborn care through the ASHA. So through the ASHA worker, home based newborn care also provided. Then essential and resuscitation services at delivery point. Okay, so we already know that in previous time home delivery occurs, but into that case emergency care are not given. So mother as well as the baby have a risk. So due to prevention of that risk, resuscitation and all emergency care provided to the newborn also. Okay. Then highly trained personnel and infrastructure at the surgical NICU. Okay. So I already told you before, that is the in surgical NICU obstetric emergency care, that is highly trained person is needed. So in that case, the training is properly given to the staff. Okay, so they use into the NICU, then giving gentamicin for suspected infections by the ENM. Okay, so by ENM nurse and midwife, that is providing antibiotic, gentamicin is given to the patients in that all care included into the newborn health. Now for the child health. Okay, so complementary and supplementary feeding provided to the children, then and folic acid supplementation also provided to the children, and in especially for the diarrheal management, given to the ORS, that is the oral rehydration solution, and zinc is provided so that we can balance into the electrolyte balance in that body. Okay, then management of the pneumonia, so we can provide the Tremoxel for the prevention of pneumonia. Then full immunization is covered, means till 5 years of age all vaccination given to the children, and RBSK screening of children for the 4Ds. So we can detect into the pregnancy, that is congenital malformation and any abnormality is there by the advancement of the technology, that is 3D and 4D sonography. Okay, so by that screening we can detect priorly. Then in adolescence health, proper given to the address for the teenage pregnancy and increase the contraceptive prevalence. We can provide knowledge related to the teenage pregnancy and also increase for the contraceptive prevalence. Okay, then introduce the peer educators. By the guidance of the peers and friends and family, they can give more, they can gain the more knowledge and awareness related to the adolescents health. Then and folic acid supplementation also given to the adolescents, and specially care for the menstrual hygiene. Okay, these all are care given to the adolescents. Then adolescents health program for adolescents group, there is a special program run through the government, that is adolescents health program. In that adolescents nutrition provided, we already discussed, that is and folic acid supplementation given to that adolescents age group. Then health education related to the reproductive health and the health issues, because in that reproductive health many issues occurs. So in that case, specially care and health education given to the adolescents group. Then menstrual hygiene already discussed above, and the preventive health checkups also done into the adolescents group. And for the adolescents group, reproductive and sexual health program also run, that is known as the URSH clinic or URSH program. In that some points are included, that is adolescents friendly health clinic provided, facility based counseling services also given. So throughout the counseling they can gain more knowledge and awareness related to the adolescents and reproductive and sexual health. Okay, then outreach activities, so that they can engage in their activities and distraction of the mind is occur. Then weekly and folic acid supplementation, so how can provide to the weekly and folic acid supplementation? So 100 mg iron and 500 microgram folic acid. Okay, then deworming of the albendazole and menstrual hygiene scheme also provide. So this kind of the guidance and knowledge provided into the adolescents reproductive and sexual health, that is the URSH program. Next one is the India Newborn Action Plan. So in this plan specially focus on to the newborn. Okay, what are the goal of this action plan? That is attain single digit neonatal mortality rate by 2030, means after 10 years they want the single digit neonatal mortality rate, means decrease neonatal mortality rate. So how can that possible? That is for intervention. In that intervention included the preconception and antenatal care are given. Then for antenatal care we already discussed, that is the early registration and detection of the high risk pregnancy done. Then fully antenatal care and visit provided to the mother. So by that we can prevent it. So risk of the mother will be decreased, and automatically for newborn also that is decreased. Then reproductive health and family planning, so we can provide knowledge related to the how maintain the family planning and how the reproductive health is then reproductive health, how to maintain it. Okay, so by that knowledge provided to the mother and family members also. Then nutrition related to intervention, so how the diet and health hygiene practice maintained by the mother and family members. So we can provide knowledge related to the nutrition so that the deficiency can reduce. Okay, then counseling and birth preparedness, we already discuss about the counseling, that is the registration. Okay, then how the care of newborn is occur and assisting into the breastfeeding. Okay, so all that point also discuss with the mother and family members so that they can also take care of the mother as well as the newborn baby. Then prevention against malaria, so by the prevention of malaria, we can save to the mother as well as the baby. Then antenatal screening, treatment for anemia, hypertension, HIV, hepatitis B, and hypothyroidism. So these all are the high risk disease. Okay. So if mother has this kind of the disease, then baby also suffer due to this kind of the disease. Okay, so by early screening and detection of the mother in antenatal phase, we can provide proper treatment and management of that kind of the disease so that the baby and mother will be safe during the postnatal period also. So these are all the intervention package for the newborn action plan. Then adolescents friendly health services and for mother, TT immunization given to mother, interval IUCD also. Interval of the IUCD insertion means intrauterine contraceptive devices provided by the interval. Then postpartum family planning service also given to the mother. Okay, so in postpartum period we have to care for the mother because in that emotional status changes and whole reproductive changes occur. So in that case also we have to take care of mother as well as newborn baby. Then use of the anti-D immunoglobulin, so provided anti-D immunoglobulin to the mother. Okay, next, care during the labor and childbirth. Okay, so how to care to the mother into the labor phase and childbirth while giving the birth of the baby. So skill birth attendants have to present there for the baby care. Okay, then clean birth practice and hygiene maintained during the birth of the baby, identification, referral, and treatment of the complication. If any complication arise during the labor and childbirth, then we can priorly try to treat it well so that the risk of the mother and baby we can provide, and identification and referral service also provided to the newborn baby as well as the mother. Okay. Then given dose of the pre-referral dose of antibiotic and steroid by the A&M nurse so that we can prevent priorly to the an allergic reaction and any infection from the baby. Okay, so antidote is given and antibiotic dose given to the newborn baby. Then immediate newborn care, which care given to the immediately by the newborn as the timing of the birth. So if delaying cord clamping, then it can be risk for the baby. Okay, so not delaying cord clamping, then how to care of the cord. Okay, that is important, and clamping and cutting of the cord is also necessary. Then prevention of the hypothermia and infection means control of the room temperature as well as about the baby's body temperature. So try to manage it and prevent of the infection chances. Then early and exclusively breastfeeding provided to the newborn baby by the mother. Okay. Then vitamin K vaccine given at the birth time and neonatal resuscitation also done into the immediate newborn care. Then how to care of the healthy newborn. So how can we provide proper care for healthy newborn? That is home care till 6 weeks by the trained ASHA worker. Okay, home care proper given till 6 weeks. Then the exclusively breastfeeding by the provided by mother and also assist the mother for helping into the exclusively breastfeeding proper technique and position how to giving the breastfeeding to the newborn baby. That is helping by ASHA worker. Then clean postnatal practices, because mother have postnatal period till 6 weeks. So we have to aware and take care of the mother as well as the newborn for healthy. Then immunization given to the newborn. Then how to care of a small and sick children. So thermal can and feeding support given to the children. Then IM and CI. Okay. And use of the antibiotic. Then injectable means provide of the infection. Antibiotic gentamicin is given by the ANM for the sepsis, means control of the infection. Then kangaroo mother care at facility. If baby is a low birth weight, then in that case for maintaining of the temperature of newborn baby, mother have provide the kangaroo mother care to the newborn. Then supportive care at block and district level, and also intensive care at the regional level provide to the small and sick children. Then care beyond newborn survival. So how to care provided to the newborn, that is the early screening by the 3D 4D sonography and early detection, and try to prevent and manage it priorly. Then follow up visit of the mother as well as the baby till 1 year and 5 year of the children. Then diagnosis and management of the birth defect. In case uh, children have any birth defect, then the early treatment and diagnostic is done, and try to prevent that kind of the serious disease. Okay, so by this I will stop. If you have any doubt, you may ask in later. Okay, thank you.